Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, good afternoon, and good evening. It brings me the greatest of pleasure to welcome you to our second IFSO MENAC webinar for this year. My name is Hazim Al-Momani, a consultant surgeon based in Abu Dhabi, the United Arab Emirates. And today I am privileged and honored to be accompanied by dear colleagues and friends of mine to discuss a topic which is very relevant, not only to our chapter, but to our IFSO society as a whole. Today, we'll be talking about women in metabolic and bariatric surgery, current status, and future prospects. I could not think of anyone better to discuss this matter than my dearest colleague, Sonia. Sonia is a very well-known colleague of ours. She's very well known amongst bariatric surgeons in general and IFSO in particular. She's the head of department of a center of excellence and a head of department of a general surgery department in Naples, Italy. She is head of the scientific committee of Young IFSO. She's also member of the scientific committee of the IFSO European chapter. And on top of that, she's a private lecturer at a university in Germany. To join our discussion, I'd have the greatest of pleasure to introduce Associate Professor Dr. Hanan Al-Ghamidi from Saudi Arabia. She's a hepatopancreatico-biliary surgeon and a bariatric surgeon, and the head of the hepatobiliary surgery department at Imam Abdurrahman bin Faisal University in the Eastern Province of Saudi Arabia. Joining her from Kuwait is Dr. Asma Rashid. Dr. Asma is a consultant general, metabolic and bariatric surgeon, and a critical care physician. She works in the Amiri Hospital in Kuwait. She's also the chair of Women Surgeons of Kuwait and a co-founder of the Pan-Arab Women Physician Association. I've got also my dear colleague, Adriana Rotondo from Arim Hospital in Abu Dhabi. She's an esophago-gastric surgeon and a pancreatic surgeon and the head of department at Arim Hospital in Abu Dhabi. Last but not least, we've got our current IFSO MENAC president, Professor Khalid Jawdat from Egypt. He's a professor of surgery at Ain Shams University, the current president of the IFSO Middle East and North Africa chapter, president of the upcoming Congress of the IFSO MENAC to be held in Cairo later this year, and an associate and advisory editor of Obesity Surgery, the official journal of IFSO. So without further delays, I pass on the mic to Sonia. For our audience, I would like to remind you to pop in your question during the discussion. We'll be grilling our panelists. They've cleared their time for you today. Feel free to ask them any question. Without further delays, Sonia, the floor is yours.
Thank you so much for this great introduction. I start immediately my video. Good afternoon to everybody. It is my great pleasure and honor to be part of this IFSO webinar, Women in Metabolic and Bariatric Surgery, Current State and Future Prospects. And I want to thank Hazem Al-Momani for invitation. Thank you for giving me this important role to talk about how female surgeons can become a bariatric and metabolic surgeon. This is my conflict of interest. This is my case mix disclosure. Yeah, and as a woman in surgery, I have to say, these are my private disclosures because obviously I'm a surgeon, I'm a scientist, but I'm also a mom and a wife. So when we talk about women in surgery, we have to say that since 2005, the number of women entering medical school has been nearly equal to that of men. But when we go further and we look at the number of general surgery trainees, we have a 38.3%. This is a number which has increased in the last 20 years. It got better, but only 25% of these trainees get assistant professors. Only 19 0.2% are female in the category associate professors, and we have less than 10% of women being full professors in surgery. This is dramatic. And when we look at the study from 2016, it's quite 8 years ago, they just concluded at this time that obviously there is a large gender gap. But at the current rate of increase, women full professors will not achieve gender parity until 2136. This is really too far away. And why do we have this gender gap? Mainly due to gender discrimination, due to a lack of visible role models, due to a lack of support and mentorship throughout their careers. Yeah, obviously, due to a difference in salary. Yeah, and due to lifestyle concerns. We are women, and maybe we want to create a family and want to have children once a day. When we look at surgeon scientists, the situation is as bad as in the academic and the surgical career, because when you look at the gender disparity in National Institutes of Health funding, you see that with the years we have more women surgeon scientists, but compared to the men who are here in orange, they are really, really underrepresented. And this means that women are underrepresented in the surgical career, but also in the scientific career. And the conclusion of this study published last year in JAMA was that we need an additional support for women surgeon scientists to achieve a gender diverse surgical research workforce. When we look at young IFSO, and this is one survey we have performed last year with the young IFSO board, all surgeons under 45, a metabolic surgery training and education survey, we saw that only 20% of the respondents were female surgeons. So up to date in the world, 20% of the surgeons, bariatric and metabolic surgeons, might be female. And when we look at the IFSO global numbers, I had the numbers from Stephanie Darko, thank you, that we only have a 25% of women in the global IFSO, but including also the integrated health. And we know that often there are more women. So globally, I think we have less than 20% of women in bariatric and metabolic surgery. And yeah, this is quite a pity, because last year we had this great publication in JAMA who showed that female surgeons have less perioperative complications. And this was, yeah, a quite popular study. We saw it in the BBC, in the Guardian, we saw it also on the socials. And when we have these conclusions, these studies, we ask ourselves, why don't we have more female surgeons? And when we look at this study also published in JAMA, talking about the association of surgeon-patient sex concordance with postoperative outcomes. And in this study, they evaluated the outcomes in sex discrepancies. So a female surgeon who operates a male patient, a male surgeon who operates a female patient, a female surgeon operating a female patient, and a man surgeon operating a male patient. And here you see in the forest plot that on the left, these are the male patients. They quite all had better outcomes with female surgeons, but here it's quite versus 0. Only in urology and vascular surgery, the male surgeons had a better outcome. But when you look at female patients, and this is quite impressive, the better outcome was always by female surgeons. So female surgeons treating female patients, and this is statistically significant, have better outcomes. Though this is really important, we have to think about this, why this happens. And this underlies also the importance to have a team, a surgical team, which is represented always by men and women. And yeah, in this study, they talked about the possibility that maybe female surgeons has more empathy or more connection with female patients. And when you look at the conclusion, they say further work should seek to understand the underlying mechanisms. We have to understand why we have this sex discordance or discrepance. Let us look at the global IFSO. This is the executive board, and we have only one great woman, our senior past president, Lillian Coe. When we look at the IFSO chapters, I realize that doing this slide, in all the IFSO chapters, we do not have any female president or member at large. When you look at the IFSO committees, Hazem Al-Momani, the head of the communication committee, but also looking at the scientific, ethic, registry, educational committee, all men. The only women, the only female head chair is Christine Stier, the head of the Bariatric Metabolic Endoscopy Committee. And it seems that we don't have women in bariatric surgery, but we have great women. And I only, filled this slide with this 4 female power women. Teresa Lamastas, our past ISMBS president, Marina Kurian, the current president of ISMBS, Rachel Moore, she was the chair of the ISMBS meeting this year. And finally, we have also women in the IFSO European chapter, Paulina Salminen, who will be elected, or who is president-elect and who will be president from 2025 to 2027. So we have great women in bariatric surgery. These are role models, and obviously there are so many around the world, but I think due to the difficulty to talk, to say what you are doing, there are so less women in the surgical societies. So why should I become a surgeon? Why should I become a bariatric and metabolic surgeon? And this is a question I ask myself really often, why I have chosen this career. But at the end, you know, it's all about passion. And when you allow your passion to become your purpose, it will one day become your profession. And I think the passion is the most important point which drives you, which helps you to be strong. And I showed you all the data which we have in the scientific literature. And now I only want to present you the steps of my career. not to talk about so much about myself, because it's a crazy life, yes, but it's not important. But the important thing is I want to show you that we have visible role models and that mentorship and support exists throughout the career. And my career started in 2010. It started in Frankfurt, Germany. I decided to do my residency in general surgery. Yeah, and I had this head of department, Professor Rudolf Weiner, who was one of the big IFSO men at that time. I didn't know it. I wanted to start general surgery. It was a good hospital in the city of Frankfurt. So I started there. But at the end, I found one of the greatest mentors who I had in my life. And this is really an important message. Choose a famous mentor. It is so important in surgery. You have to have someone who shows you how to operate, who shows you how to think, who shows you how to interact, to give indication, what to do in complications, what is the organization of a department. And yes, Professor Rudolf Weiner was IFSO European chapter president, then IFSO president 2014, 2015. And he organized the World Congress in 2011. So he was really a really big mentor. And this is of greatest importance. And this is important for all surgical specialties at the end. When you have someone with a name, an international name, you will also grow up. And obviously, you have to work with great women. I named Christine Stier before. I am really glad that I met her in my life. She grew me up. And yeah, she was my mentor in the daily surgical practice. She taught me bariatric endoscopy and scientific thinking, to be curious. And this was really important for me to grow up. I had Sofia Theodoridou, a great surgeon, and severe, but really great surgeon. And I had Sylvia Weiner, who, yeah, at the end was part of this female group. She is the daughter of Rudolf Weiner, but it was important to be a female group, to work together. Sylvia Weiner, from the beginning on, inserted me in the Frankfurter meeting, in the international networking. And I'm so thankful that I had these three women in my life, in my surgical career. And obviously, you have to organize congresses. And yeah, I said it before, we had the Frankfurter meeting, but this is great. When you organize international meetings, you get to know the best surgeons from around the world. And yeah, you have to think in big. Yeah, you can discuss important or complex cases with the best ones. And obviously, when you have the opportunity, change your city, change your country. Don't stay always in the same hospital, because if not, you are thinking only in your own house. You have to think abroad. You have to watch abroad. What are doing the others? What are different mentalities? And then you can create your own mentality to work. Pick up the best things from every country, from every city, from every department, from every chief surgeon, or from the surgeons you have around. And for me, I went from Germany to Milan, Italy, for doing Erasmus. I frequented there the surgical department. At the end, I knew my husband, who is also a surgeon. Yeah, and this was really important for my life. And San Raffaele Hospital was a great hospital with also a really important surgeon, Professor Carlos Daudache, who is a great laparoscopic surgeon. And in his department, I have learned for 1.5 years so many things. And at the end, you have to stay in the war. You have to, be passionate day and night. And the more you stay, the more you see. Also, when you're only watching, you learn, because this watching will help you when in 10 years you're autonomous. And when you are in a difficult situation, and you will remember what your surgical mentors did in this situation, because you can't think. It's autonomous. And when it's inside of you, you can manage it. And yeah, you have to be curious. The scientific work is because you want to understand certain things. You want to have better outcomes in your patients. You have to get better. And when you not study, you don't get better. So when I was in the pancreatic unit in Milan, I asked myself, coming from Germany, from a bariatric unit, diabetes improve after gastric bypass? What happens after pancreatic surgery? You also exclude in the Whipple operation the duodenum. You have a bypass system. So is it possible that also these patients have amelioration in diabetes or diabetes remission? So I analyzed all these patients, and there was also in oncologic surgery amelioration of the diabetes due to exclusion of the duodenum. This is great, but you have to be curious. And obviously, when you want to get specialized in one surgery, you have to work in a high volume center. We had this high volume center, this department of bariatric and metabolic surgery with 42 beds under Rudolf Weiner, only bariatric surgery. And at this time, we performed 1,000 surgeries a year, which 8-9 years ago was really a high number, and is still a high number. And when you have in your department, obviously the operating room, the intensive care unit, and you include also the endoscopy, you have a full department. And so I grew up also with the endoscopic bariatric treatments. In this day, the surgical complication treatment was not only endoscopic, but up to date, we know that fistula, endoluminal bleeding is a complication who goes to the endoscopy and not back to the OR. So this is important. Choose a center, a high volume center, a center of excellence, a high volume center to get better, get specialized. Obviously, you have to work hard. You see our faces. I'm now after 12 hours of surgery. It's hard, but when you like it, you do it. Study and care for your patients. One of the most important messages. The patients are the center of the work, not you, not your colleagues, not somebody else. You have to work for your patients. And this helps you to get satisfied, because the patients are the ones who thank you. It's not the money. It's the patient satisfaction. Obviously, when you then get a specialist in general surgery, this is a point of no return. You can't go back, and you have to go ahead. So you have to set a goal, you have to make a plan, you have to stay focused, you have to work hard, but also man has to work hard. Surgery is a hard job, and you have to succeed, and you have to stay humble always. you have to build international working groups. Because when you work internationally and when you do scientific work internationally, you get to know the surgical scientists. And with them, you can discuss when you have ideas, when you have problems. You have a really great background. You have to study, you have to write. I said it just before. Publications are important, not to get, not only to get an academic career, but to get better, to stay tuned, to go on. Organize workshops. Obviously, when you're younger, maybe you don't have the power, but if the head of the department has a specialty, help him or her to organize workshops. They will be happy because, you know, when you're getting more up in the hierarchy, you do not have time. And when you are young and when you help your head of department to organize workshop, to be present, you will profit from this because you will learn how to manage, how to organize, and your head will be happy to have someone around who helps him or her. Be politically active. Obviously, you normally start in the national society. So I was the secretary of the German Association for the Study of Obesity. And after the national, then the international comes. Think international. We have a lot of international clubs, groups, and so on. Be active. And obviously, be part of IFSO. And when you are young, when you are under 45 years, be part of Young IFSO, because we are creating, or we are trying to help youngsters to get involved. This is networking. It's easier to call a younger surgeon to ask for help than maybe one of the big ones. So networking in Young IFSO is really, really important. And here you can see the whole Young IFSO board with 1, 2, 3 women, still underrepresented. We organized this year, I organized in February, the first animal lab for young surgeons, become a bariatric and metabolic surgeon. It was a great success. And when you look at the picture, you see female and male surgeons are quite 50-50%. So I'm positive. I hope that the future will change. But when you are a young female surgeon, contact us. You can contact us ever. Maybe go to the courses on the IFSO meetings. We have always a Young IFSO session, and we will help you. We had the second Life Surgery Congress with so many great young surgeons who performed great robotic bariatric surgery. We had 2 female surgeons who won the best video prizes. This was held by Benji Pascotto in Luxembourg. And we have another meeting from Aaron Taskin, the past Young IFSO president, in Turkey in October. So we have started to do this, become a bariatric and metabolic surgeon congresses, animal labs courses, and there you can talk to us, to the female surgeons, and you get a help. You can ask me, how have you done it to get a child and be also a surgeon? How was pregnancy during surgery? How is it at home? How you manage it? We can talk to each other. And when you talk about your problems, you always find a solution. Be strong. You have to be strong always. And obviously, you have to learn how to be strong alone. Sometimes it's difficult because you don't have always somebody around, but you can do it. You can be strong because we are female, we are women. Be organized, obviously. This is, I think, one of the most important things, because obviously you have to be organized at work to do so many things in parallel, to operate, to get a good surgeon, to look after your patients, to do scientific work. You have to be organized. But also at home, you have to delegate. You can't do everything. You can't be a perfect housewife, a perfect surgeon. It's impossible. So delegate the things which are not important for you. And obviously, the children or a child are the most important thing for women. But you cannot stay with a child the whole day when you are a surgeon, when you're a working mother. So you have to create the quality time. And for the rest, you can have a babysitter, housewife, and so on. So learn to delegate and learn to say no. You don't always have to be the good one. Women, or from women, often it is asked that they help, that they are nice, that they are empathic, but you cannot do it always. So say no in the right moment and reflect. You should examine yourself daily. If you find faults, you should correct them. When you find none, you should try even harder. And this helps you. This helps you, to go ahead. Because when you go ahead, you see with the time, everything is getting easier. And obviously, be a woman. Don't try to be a female surgeon being a man. I have to say, when I still was a student, I met some surgeons, women, female surgeons, who told me not to be attractive, because this can irritate, obviously, the surgeon. And so when you see my hands, I never put nails on my fingers. In the hospital, I always have my hair, obviously, closed, but we are women. So when we go outside, we can be a woman, we can be a mother, and sensitivity, warmth, apprehension, tension, self-reliance, liveliness, abstractedness, these are good parts of us. We don't have to be dominant, and we don't have to be hard. And the patients love female surgeons because you talk to them, you have empathy, you understand them. So be a woman, be like you are, be resilient, obviously, physically, emotionally, spiritually, and mentally. You have to be resilient when you want to be a female surgeon, because the men don't like to see a female surgeon who maybe is better than them, who maybe has more patience. But don't create this competition. Create team working, because it's not who's the better surgeon. It's not the female surgeons are better or male surgeons are better. The surgeons who has certain characteristics, who work hard, who have also obviously the manual possibility, but these are great surgeons. And a team need female and male surgeons. This is important. You have to have good friends, because you need an open ear. when you are not feeling good or when you have a complication, and you need somebody who understands you, who is there for you. And when you have a great colleague, a great surgeon, and also a great friend, and this is Christine Stier for me. She was a mentor for my whole life. Work together. Yeah. So when you are in a friendship, when you maybe go outside for dinner, obviously you talk about your passion, which is surgeon and surgery, and use this. It's easy working. Be mentally strong, move on, don't waste time, welcome challenges, stay happy, be kind, be fair, unafraid to speak up, say when something is wrong. Calculate a risk, take it if it's possible to take it, and celebrate other people's success. This is important because you are not the center of the world. This is maybe my daughter. She still thinks she is the center of the world, and I'm happy about this. But when you grew up, you have to learn to be happy about other success. And when you're happy for another one, she will also be happy for you. And this is team working. So when you are in a team, you grow up together and you all get better together. But obviously, there are surgeons where you don't have empathy with, and others which you feel nearer. So obviously, like friends, choose the one you can work well with. Do not fear. In surgery, you aren't allowed to fear. You have to calculate the risk, but do not fear. It tells you what weakness is. And once you know your weakness, you become stronger. This is important. Be humble, be always humble. The nature can do everything. So be humble. Create a good team and share. This is my bariatric and metabolic team. And when you create a good team, this team will get bigger. And this is the whole department, which I'm now head from the general surgery, also with our nurses. And prevent. These are the last two quotes I give you. Intellectuals solve problems. Geniuses prevent them. So when you are performing surgery, you have just to think about to prevent complications. And this you will learn in your surgical career because you will have complications. This is normal. But when you analyze them, when you look why there was a complication, you learn from it. And then you learn to prevent them. And this is the most important thing, to get always better. And you have to get better because your patients need it. And one quote my husband always says to me, but this is a quote I have to say is really, really one of the most important ones for you, your surgical career, and your work as a surgeon. So this is the last one. If you are not part of the solution, then you are part of the problem. So when you have a problem, try to find a solution and try to solve it. And obviously, love your patients, because this work is hard and you have to love them. Thank you for your attention. It's my pleasure and honor to invite you also to the next second edition of Become a Bariatric and Metabolic Surgeon next year in Naples in February 2025. And I'm now open for discussion. Our panelists have also great stories to tell. They are great female surgeons, and I hope that in some way I could encourage you to go ahead to be a bariatric and metabolic surgeon. Thank you.
Thank you so much, Sonia. That was very impressive. I'd have to congratulate you and applaud you for your passion and for the messages that you have delivered. There's a lot of messages to talk about. I'm not sure we even have enough time. So if my colleagues would allow me, we'll start the discussion. And if I may, I'd start with Professor Hanan. Professor Hanan, talk us about your story. You've got a very interesting story. I know you were born and raised in Saudi, moved to Canada, and then became a HBB surgeon. And now you're amongst us as a bariatric surgeon. What made you make that change or do that change? Is it a person? Is it an influence? Is it the nature of the business? Tell us more, please.
First of all, I would like to thank you and all my colleagues in the panel, and specifically Sonia. It's really very impressive life journey. And after this impressive presentation, we should all just applaud and congratulate. Yes, there is a lot of challenges for a woman. We have to admit this. But like everything in life, there will be challenges, and the demand for these challenges is specific character. And if we really want to be very, very constructive, then we can do like an inventory personality survey and surgical personality, which is already been done. There is an inventory of personality done by the French group and in Holland. And this is look into the personality character at different generation, student, trainees, and consultant. Open-mindedness, the main domain of the personality character is the open-mindedness, the consensuousness, agreeability, low in burnout, and extraversion. We can see there is no gender difference in all the study that done this inventory survey. And this is authenticated tool of measuring the personality character. And this will reflect definitely on the outcome of the surgeon, male or female. And I'm talking about complication, the ability to make judgment in difficult situation. So my point is there is embedded character and skills in everyone, male or female. We have to focus on looking and picking and selecting and supporting the right person to go to the specialty, because in some situations, some geographical area, biased selection and support for surgeon based on gender is disastrous and life-threatening for the patient.
So how has Hanan become a bariatric surgeon?
First, my interest was definitely in subspecialty, like a liver. However, when I started training in 2004 in Australia and in Canada until end of 2007, minimal invasive in hepatobiliary was lacking. And most of my bosses at that time, they're doing also the general and advanced bariatric surgery. So I gained for them this experience. And I wanted to do this to improve my skill in minimal invasive surgery. And we have a large volume for this condition. And I cannot imagine improving my skill in minimal invasive and hepatobiliary without really getting into this subspecialty. Currently, it's around 80% of my practice, 70 to 80%. And it did help me a lot in minimal invasive. Most of my hepatobiliary are done by minimal invasive, including Whipple and major liver resection. So it does help. And if you come probably from a higher stressful, demanding subspecialty, it's easier for you to do. I'm not saying it is, underestimation or anything, but it's related to it. So this is how I reach. There's a lot to be done, but I'll give my colleagues the chance to also hear from their stories. So,
I mean, we're very privileged to be amongst you, to be honest. Each one of you have got a story to tell, and I think we can have one webinar for each of you. Asma, talk us through your experience about setting up these societies that you played a big role in women in surgery, whether it's in the GCC region, which is the Gulf region, or in Kuwait. How was this idea incepted? What were the challenges, and how easy or not so easy was the journey?
Thank you for having me here today. And it's a great pleasure to be among you all. I did my training in general surgery and in bariatric surgery and critical care in Canada. Was sponsored by my government to go there and do my training. So obviously when I came back, I started working in one of the governmental hospitals here in Kuwait. Coming from a different system, mixed me in a different environment to a different place, make me ask myself or have some observation that maybe there are things related to the system, but maybe there are things that are related to the gender or the fact that being a woman in surgery. So gradually looking around me, seeing not a lot of women in the hospital within the specialty, and then going and engaging around in Kuwait, attending other local conferences, started to think about how about we as women in this field work together. First, by knowing each other, right? Like you cannot build a team and work with something if you don't know the person you're working with. So in 2018, we went out for our first breakfast with a group of women from different hospitals here in Kuwait in surgery. And then gradually getting to know each other and seeing what are the needs, what are we missing, what are the things that we really want to grow and improve, had the idea about starting the Women Surgeons of Kuwait group. So in 2019, and this also highlights the importance of having an open community, surgical community to the idea. Kuwait Association of Surgeons, we're happy to have the Women Surgeons Committee with them, and that was in February 2019. And from there, we were able to grow that community and hold the first conference for the Women Surgeons of Kuwait and the Women Surgeons of the Gulf as well in November 2019, in which we were able to connect more women together in the region. And then from that, also building up into creating the group of women surgeons of the Gulf, having our conferences yearly. During Corona, was 2020 in Saudi Arabia and Riyadh by Professor Samir Al-Hamoud. And then, of course, it was online. And then the year after that with Dr. Moza from in UAE, actually 2021. And then after that in Oman in person, with Dr. Al-Belushi, and then this upcoming year, inshallah, in Qatar, hopefully in October this year, 2024. So this is just to say in the region. This also was an opportunity to collaborate with a lot of international bodies, such as the American College of Surgeons and the Association of Women Surgeons, that is the oldest body that was founded in 1981 by Dr. Patricia Newman, who we had actually the honor to have her in Kuwait attend our conference and our gatherings. So This is just to give an idea that how we together started here in Kuwait, and also not only at the level of the surgeons, but also inspiring students. So having chapters, for example, Association of Women Surgeons, having other chapters in some of the regions. And this also was a step not only for the surgeons, but also help us to communicate and collaborate with our colleague women physicians. And I had the opportunity to be one of the co-founders for the Pan-Arab Women Association, the conference we will be hosting, the second conference, hopefully in Kuwait in December. So this is just a quick brief. I don't want to take a lot of the time, but to share some of the work that we have here.
And what lessons have you learned that you can share with our listeners during this journey?
So I think one of the things that I want to say, there are commonality in terms of the challenges that women have in the field of surgery across all the subspecialties in general, but also there are some opportunities. In addition to the women surgeons, we created, for example, the Women Surgeon Research Network, because we did know that, for example, research in certain, like in high developed countries, is different than when you want to look at the region. And I don't want to generalize on, because we have some great countries with great research experience, but I'm saying there are gaps that can be bridged through these initiatives. The other thing is that, for example, one of the main important things is that pay, equal pay, which I see, for example, in our region, in the Middle East region, is actually we have a head start because men and women are paid equally. Whereas if you look, for example, at the United States, for every like 87 cents is for a woman surgeon, the man will get like $1. So from that, with that, we do not have a gap. If you want to go in a little bit more details and say, but as women in the field of surgery, maybe they do not have enough mentorship. When you want to talk about private practice, governmental practice, maybe there's not enough guidance, and eventually maybe the man surgeon will make more. But if you look at law does not differentiate, for example. So some of the lessons, as I say, there are common challenges, but there are also differences among internationally and regionally.
So am I right to conclude, Asma, that it wasn't such a hard journey as long as the willingness is there and the passion is there?
I think it's sometimes, like, to be very honest with you, we often find that the person have to put a lot of effort. But the way I see it is that to ensure sustainability of women being in the field of bariatric surgery or any surgical specialty, it is really important to highlight where are the issues. Some is related to the system, institutions, and then some of the other thing that could be, I would say, I always divide them into internal and external factors. Internal should be such as self-doubt or imposter syndrome, creating community, etc. But then there are things that is related to the institutions where women in surgery work, as well as how you set up the system. This is the way I see it. So if you want to think about sustainability, these are the areas we need to work on to encourage women to be in that field. And if I may add one point here, because Dr. Sonia already mentioned great papers that are there that talks about the great outcome for women in surgery. But what I want to highlight is also women in surgery are at a higher risk of having, during childbirth, having relationships, and further and then there are studies that are published in JAMA and so forth that looks at health risks for women in surgery. So they would, the age where they would have the kids, the maternal complication that they could have, and so forth. I don't want to go into much details, but also for all the great that they are work and all the contribution they add, they are also in a disadvantaged position. So there's a lot of work that needs to be done.
It's loud and clear, Asma. I hear you very well. Adriana, you've got another exciting story to share. I mean, you're Italian, you trained in the UK, worked as a consultant there. You started doing esophageal-gastric surgery, and here you are, a bariatric surgeon, a well-established, well-respected bariatric surgeon in Abu Dhabi. Talking off the top of my head, I probably believe you're the only female bariatric surgeon we have in Abu Dhabi. So
yes.
Tell us more. I mean, Sonia touched about travel exposure experience. What is it that you could tell our young listeners who are thinking or dreaming of one day being where we are now?
Well, thank you very much, and really it's an honor to be among all of you because it's a fantastic panel. I am really lucky, but of course, as many of you had to work very hard to reach this position. I think as women in this country, in UAE, we are actually have an advantage because, of course, there are many women who would like to have a surgery with a female surgeon, but of course they would trust you. Oops, I think there is something. They would trust you only if you are very experienced and if you are someone honest and professional. So I think the road to become a surgeon is quite difficult. You will face some failure along the way. What I would always suggest to young surgeons is not to get to get upset to have any failure, but to embrace failure and go ahead. Because if you have got passion, you can reach certainly a stage where you become a consultant, even if you have some bumps on the road. But certainly, I think there is, you know, the biological clock for a woman cross the career path, no? When I was 35 and I was ready to become a consultant, 35, 36 in UK, of course, it was my biological clock. And I was like so career oriented that I left that behind me, and the time went by and I concentrated more on my career than on the family. Of course, then I was very lucky because at the age of 43, I actually had my only child. And of course, I can tell you that that is the best achievement of my life. But of course, I can understand that as a woman, it's difficult to choose along your career to have a family. And when I meet students, I ask them why they don't want to become surgeons. The female students actually say, I want to have a family, because they are scared that going through the surgical career, they will not be able to have a family. They think it's quite true, it's difficult, it's very hard to have a family and be a surgeon. So this is my point of view. So I think the advice I would give to the surgeon, to the female surgeon in training, at some point they need also to think about a family, if they want a family. And they actually it is possible to be pregnant and still work. I was operating until I was 37 weeks pregnant. And of course, if you are fit and healthy, this is feasible. But of course, it's more difficult than a male.
No, we can't operate even if we have a cold, Adriana, you should know.
Sorry?
We can't operate even if we just have a simple cold, you know that. All right.
No, but it's true, actually, you know.
Thank you.
I think for female is more difficult to have a family.
Yeah. Khaled, you're in the hot seat here because you're representing the authority. Sonia touched a lot about mentorship, training, role models, etc., etc. In your capacity with your IFSO president hat on, what is it that you believe could be done differently? Let's say, for example, in our region, we can't make comments about other chapters. What things you believe can be done differently from the IFSO Middle East and North Africa chapter to perhaps integrate more female surgeons? We've got a lot of female colleagues with the allied health, with dietitians, perhaps even bariatric medicine, but the surgeon side is always underrepresented. What is it that you think that could be done differently?
Well, you know, Hazem, I'm the oldest of anybody here, even probably participating attendee, and everybody. I graduated 30 years ago. Okay, when I graduated, having a female surgeon was like a joke. You cannot have a female surgeon. And because we know we're in the Muslim world, we had husbands that would not like to expose their wives to male surgeons. So when I graduated, the only possibility for a lady or a woman to become a surgeon is to either be a breast surgeon, anal surgery, or an OBGYN. And
Correct.
I think we've gone a long way, because now they are going everywhere and being mainstream. Hepatobiliary surgeon as a lady, as Dr. Hanan, that unheard of 30 years ago. So I think we're progressing very well, and as Gianna said, it's just you have to be confident and good and honest and give good care, and people will come. So I think there's nothing now stopping women from becoming bariatric surgeons anywhere, and it just needs some endurance, because at my time, women would not even think of surgical specialties, but now you see they are competing, and as Matt said, 50% of the surgeons in some of the pictures we saw in Sonia's amazing lecture were women. So I think it's from now on, it's just all the way to go. It's all the way up.
So am I right to conclude, Khalid, that we do have the political willpower, whether at government's level, whether at society's level, and even at families level? The only thing holding people back now is probably themselves. And this is something Sonia had touched on.
Yeah, and also I think it's to get the trust of the society to treat male and female surgeons equally, but that would come with time and experience and cases, and I think it's there to stay. Yeah.
Fair enough. I agree. I mean, I would like to hear the opinion of our colleagues. Do you agree with what Dr. Khalid is saying? Because me, as a man, I believe what he's saying is true. At least in our region, we've seen a huge shift from governments towards empowering women, giving them the power, the autonomy, the authority. Women have got a choice nowadays with marriage, with having children, with career. We don't have the pay gaps that other parts of the world might have. But of course, there is something or a sacrifice that had to be given, and decision, a conscious decision would have to be taken at one point, as in, when would I like to have a family? What is the priority at any particular point of my life? Does that sound reasonable conclusion from what Professor Khalid has mentioned, ladies?
To me, yeah, I think that's really great to hear that, because I think a direction we need everybody to go in. If I might just add a point regarding having children during training, as everybody mentioned before, it's like really difficult, and especially if you have a spouse or a partner who is, for example, within the medical field or outside the medical field. For me, from my personal experience, if I would say, because I have 3 children, and all of them I actually had during my training. So by the time I finished my fellowship, I completed my family. It was actually very challenging in terms of doing prioritization, but this is a skill that you learn. And the fact when we create a community, such as the women surgeons, for example, the role of the men is extremely important. To me, actually, they are the foundation for a successful family. So having a spouse or a partner who is there to share with, to understand, and you as a couple decide what comes first and what comes next is crucial for the success. So if somebody comes usually from the younger ones and come and ask me about my personal experience, how would I say? I do not decide for you. You know what's best for you. But it's important to see with what you have, what is the time for what, and what can you do at this time. Of course, having a lot of resources and having a support that you could lean in will help you move forward. And then the idea of having mentorship programs into the societies help navigate a lot of issues. One of it would be like career integration, in addition to all the, the research, the career advancement, etc. So this will be my 2 points that I would like to add regarding this point.
We hear you. We hear you. Sonia, following your career, looking at your presentation, we could see you've got a long journey. So if you are to do it differently, what advice would you tell our young surgeons, be it females or males, to be honest, because you have a very successful career to be proud of. If you could to have done it differently, what would you have done?
I think in my younger years, instead of going to Italy, maybe I would also have been gone to the US or Canada or UK, an English speaking
Language.
Language, yeah. Yeah, this is
Language.
helpful.
Language.
This is helpful.
Good point. Dr. Hanan, if you are to do things in a different way, what would you have done?
No, actually, if I advise a young surgeon in training, I would advise them to really have a focus in physical, mental, and psychological balance. It's extremely important to be really, organized regarding physical fitness, because it is a demanding specialty, physically, mentally, and psychologically. And it is trainable. Everything is trainable, including the physical fitness and the emotional stability and the mental fitness also, plus the knowledge like everybody else. So they have to focus more than probably the male and then this year's shoes.
Asma, same question.
I don't think honestly I would change anything. Honestly, like I think I had a very interesting ride. Dr. Sonia mentioned that she would go to the States maybe because of English. I did my bariatric surgery in a French hospital, so I had to run to work on my French there. So that was a bit challenging. I wouldn't change anything for me, and I would continue to learn as life goes along. But I would have definitely hoped that I would have got mentors for myself, because I felt like that Dr. Sonia was so lucky that she could have chose a mentor. I think for me, I did not have the opportunity. I did have good interactions with a lot of surgeons who are role models, but I did not have the mentorship that I would have hoped for.
Yeah. I think this is something Sonia mentioned, and during our discussion previously with Dr. Hanan talked about. Networking is very, very important in any specialty. Attend conferences, attend events, send in abstract submissions. Even if you go with a poster, just you need to know who's who and who's what. A lot of people are happy to help. If they can't help you, they'll hook you up with someone else who could help you. And this is something Dr. Hanan touched about yesterday. Adriana, what would you have done differently?
To be honest with you, despite I got married and the child very late, I don't have any regret. I think I had a fantastic path in my career. I had very, very good mentors. The only things I wish I met my husband much earlier, because as Asma said, you need someone really supporting when you are a surgeon. And of course, as a female surgeon, we do recognize to have a very strong personality. And it's not easy for a man to stand such a personality sometimes. So, of course, I had the luck to meet this man a little bit late, but okay. A man who supports you, because, of course, you need that.
Well, I think the message is family. Family is the core. And I loved that side of Sonia's talk. All of us, we need somewhere safe to go back to feel safe with and to recharge our battery. As you say, Sonia, unfortunately, a lot of our struggles, you struggle on your own. And this is something that you'd need to learn to become a successful surgeon. Professor Jawdat.
Well, I think I should give a recommendation to every woman and maybe every man. That's because this is universal. Just keep learning, look for mentors, and forget your ego. Ego is the enemy, is the real enemy that stops anybody from learning. So with this, a woman or a man, they will just succeed in their career and conquer the heights of their specialty.
Fair enough. Fair enough. Sonia, any last messages before we conclude? I mean, the discussion, to be honest, can carry on for hours and hours, but I know that some of you have got commitments to attend to. Any last messages? To be honest, every aspect, every facet of your presentation was perfect. You covered many, many points. You talked about the career, the mentorship, the endoscopy, the complication, the importance of the team, the family, the importance, the message that I love, the fact that you said, be a woman, and you don't need to be a woman trying to become a male surgeon. We are different. We are different for a reason. Be a woman who is a surgeon. So any last messages?
Yeah, be yourself and try to work in a team with male and female surgeons to become the best for our patients.
Agree. All right. Any last messages from any of you guys? If you'd allow me, then I draw this webinar to an end. I'd like to thank each and every one of you for your input, your insight, and your time. I'd like to thank our audience. I would like to remind all of you who have not been able to watch the full webinar that you can watch a recording of this webinar on our IFSO YouTube channel and on IFSO Virtual Academy. Do not forget, September is IFSO Melbourne. We look forward to seeing you there. Make sure to book for the tours, book for the hotel, and book for the talks. And obviously, don't forget the IFSO MENAC. The conference will be in Cairo. Professor Jawdat always throws in an amazing party. Make sure to make it there. Thank you all very much. It's been a real pleasure meeting you all. Thanks for your time. It's me, Hazem from Abu Dhabi, wishing you a lovely day. Goodbye.